Today, with this video, we're going to teach how to properly sleep on your side. All right, let's go ahead and turn on your side for me. Everyone is different sizes and body types. So there isn't one particular pillow or one particular mattress that we recommend. Everyone's a pretty individual. So if you understand what position you need to be in, you know what type of pillow mattress is going to be best for you. First, let's start at the head. The head, you want it to be level with the bed. And some people like to have a nice, great big pillow and the head's cocked up. This puts a lot of stress across the neck. Some people, this patient here, if you have really broad shoulders and your pillow's too small, you're going to have something that's going to be like that, and his head's going to drop down to reach the pillow. We don't want that either. You want to keep the head level, parallel with the bed, and for this gentleman, it's going to be about so. Next, we want to take the pillow and pull it around the middle of the neck. Some people like to sleep with their shoulder on the pillow. We try to not recommend that because we want to give that middle neck support. So by curling and having a good bit of pillow in the crease of the neck, that's going to better support the middle and upper part of the neck. Next, a lot of people when they're on their side like to roll into a fetal position. They like to put their hands underneath their chin and their heads cocked back. Go ahead, pull more into a fetal position here. Hands really back like that. So with their hands, what they're trying to do, they're trying to support the neck, and it actually pushes the head back into a backward bent position. This causes a lot of compression on the back of the neck. Not something you want to do for 8 hours. So we want to take the hands out. I tell the patient to try to keep their eyes directed down toward their knees. This is going to put his head more into a neutral position, taking pressure off the neck. In the shoulders, you see this arm is pulling. It has nowhere to go. So what happens is the arm just ends up having to fall forward. This pulls on the shoulder, which pulls on your neck. Keep in mind, anything that happens on the shoulder happens in the neck. And this gentleman has a pretty heavy, thick arm, which will pull constantly the whole time. We recommend a hug pillow. Take a pillow, maybe one, maybe two, shove them in a pillowcase, depending on your size. You want to have it right in front. Okay, this. Now you can see his elbow is level or maybe even a little higher than his shoulder. By doing this, it takes the weight off the arm, off the shoulder, which takes the pressure and the stress off his neck. We're moving down the spine. Low back. As you can see here, his knee is lower than his hip. This pulls on his hip, which puts pressure on your back. I recommend take 2, maybe 3 standard pillows, depending on the quality of the pillow. Shove them in one pillowcase so you have one big, firm pillow. That pillow will be placed between the knees. Right. Now, as you can see now, his knee is higher than his hip, but that takes pressure off the hip, which takes pressure off his back. This is the ultimate position for sleeping on your side. Keep in mind, this is a new habit. You're going to wake up in the middle of the night, pillows are going to be on the floor. It's okay, you grab them, put them back in place like we just discussed. It will take 2 to 4 weeks to break a new habit, but once you do, you'll never turn back.